are all my notes from my doctor's visits. I'm trying to look over all of them because there are a lot of over-the-counter medication that I need to get because cancer is killed by chemo, which is very effective in killing cells. However, it doesn't know the good cells versus the bad cells. So there's other parts of your body that get damaged in the process. This book has everything that I wanted to know about chemotherapy and more. It's something that MD Anderson provides you, and it's going to be my Bible the next 5 to 6 months. Hey guys, surgery went well. My port is placed, ready to go for chemo for tomorrow. I'm just resting now. Hey guys, it's week 2. It's been full of more tests this week, as well as blood work and x-rays, MRIs. Kind of dry to tell you everything in detail, so I thought I would skip over to some of the more cool stuff. This week has been very tiring because of all the tests and hospital visits. But one of the things that I want to focus on are more of the positives. So this week I've learned a lot of pre-cancerous tips from my family, friends, and pink sisters near and far from me. One of the tips I've learned is that you need to record what your doctor is saying, either by your phone or another device. Even if it doesn't show their face, after you ask for permission, make sure you record what they're saying, because half the time you're not going to remember what they're saying. And it's always good to replay, especially when your spouse or family member is unable to attend due to the COVID measures that are going on right now. No visitors allowed. So that's something I would keep in mind. Also, if you haven't done this already, make sure that someone within your own family or friends can start a meal train for you. This has been quite helpful for us because we have designated days that we know that someone will provide some sort of food for myself and my family. We also have added shifts for childcare, so during, bath time, bedtime, all of that, it's very strenuous on one person to do. So we've also asked for help on that. And it's been amazing to see my community friends and my church members really step in and help up. Even though I don't know all of them, I'm so appreciative of everyone who has volunteered and taken a shift up, no matter how close or far they live from me. So thankful to my church. And last tip is that you'll either be asked if you want to be connected to a friend of a friend who already went through this breast cancer journey before, or if not, you can always ask a friend. For me, I knew a couple people that were going through this, but I didn't know very many. And so friends of friends have all connected me to one of their friends, and it's been quite helpful because a lot of these terms that doctors use are, it's in English, but it's not in English. So it's great to get it in layman's terms, exactly what it means, what I'm going to feel. So for me, I'm really thankful to my pink sisters who I have connected, either I've known in person and I've connected over the internet, or I've actually never met this person, but because of what they have gone through, I am able to connect and ask for questions and help. So very thankful to that community. That kind of wraps up week 2. Next week we'll have a port surgery. We'll also have chemo starting and Neulasta, another MRI on a possible suspicious lymph node near my rib. And I think that's also when my hair will start falling out. So I'm trying to utilize or enjoy having long hair as much as possible, but I think I'll start cutting it this week, shoulder length.